At that young age, sure, you can do it, and we do it. And there are other patients that have juvenile rheumatoid arthritis that are teenagers that have these procedures done. And the age by itself is not a definite no. It's just a matter of understanding that when you're going in that young, you're looking at, over your lifetime, needing to have probably multiple procedures, and each of those procedures that follow are more complicated and more difficult. And on the other side of it, we get patients, am I too old to have this done? And I think that for those patients that are having trouble, that age between 60 to 70 is a good age if you're limited to think about doing it, because two things happen as you get older. You don't know what your health is going to be like. And just generally speaking, it's harder to recover as you get older. There are people that fracture and break their hip in their 90s, and we're doing, partials, if not totals. And it's not just the age, the number by itself. And then the follow-up question to that, what I tell people who do not have fractures is that when you have a knee replacement or a hip replacement, even though you might feel up 3 to 7 days later going out of the house and doing things, really, from the infection standpoint, you want to make sure that your wound is healed in the first 12 to 14 days. I like people to just be at home and getting up every hour or two and walking around for 5 or 10 minutes, not out of the house. In terms of getting back to a desk job, it's typically feasible 2 weeks later to do that. In terms of getting out and walking for 2 or 3 miles in the community, that varies from person to person, but I think 6 weeks is a good estimation for that. Yes?